In this video, I'm going to show you one of the positions we use to find immediate reduction of pain associated to Piriformis Syndrome. Hey everyone, I'm Sebastian at Performance Play Sports Care, part of the locally world-famous chiropractors in Costa Mesa, California. We're going to use something like a simple box or a chair for this demonstration today. The reason why I chose the box is because all I have right here. But something like a dinner table chair where there's actually a cutout where you can slide your hips underneath the chair itself and disappear into the chair actually works really, really well. Things like rolling chairs where they have all those different legs on them, it limits the ability of how much you can get underneath the chair. So it's really up to you what you have. So pause the video and go find something if you want to follow along. Now, if you are wondering if this video is actually for you, it's important to realize the location of the problem that we're talking about. And so we're talking about pain or tightness, deep tightness right into here. It may come on with activity, it may come on with walking or sitting or so on. And for some people, it comes around all the times of the day. For other people, just small amounts. That's okay. And so it's right into here. We're not talking about problems into the crest here. We're not talking about the sit bone. We're not talking about the hamstring. We're not talking about the IT band. We're not talking about the side of the hip like the trochanter. We're not talking about the SI joint. We're not talking about the low back. We're not talking about sciatica or leg pain down to the foot, numbness, tingling. However, if we do have all those or some of them, it's important to note that some people have complicated aspects to their problem. So they have multiple different things that are going on. So if you're wondering about those too, we have a webinar that's going to pop up in the corner which covers different types of things that people have probably heard about or experiencing associated to this problem. So please take advantage of that. It's completely free, it's entertaining, and it educates you a little bit more. Now for the demonstration here, I'm going to use the highest position of this box for me, which is 16 inches. All right. So what I'm going to do is first, I'm just going to go into what we call this the hook line position. Some people call it the rescue position because it feels so good that it rescues you from the problem. Now, when you find a position, you may have to tinker with it. All right. No position is perfect for everybody. I know that for the position that I'm in right now, my belt is actually cutting into like my gluteal area and it doesn't feel good. So a slight modification may just be a change of wardrobe. All right. So we usually ask people to be in this position for just a couple minutes first, baseline, just to see what happens. Normally there's three things that will happen. It'll either get worse, it'll get way better, or nothing. All right. Obviously, if it gets worse, stop this. Like, you need to be examined anyways to figure out exactly what to do for you. If you're looking for help from us, we have a link in the description below where you can work with us virtually or in person. Now, if it's getting way better, sometimes just spending more time in this position throughout the day is super helpful. And now, some of you may say, well, I get in this position, it feels better, but I get up and walk around and it comes back. Well, yeah. You know, some people have very acute scenarios, some people have subacute ones, some people have chronic ones. Everybody's a little bit different, but when it's acute, you have to assume there's a fire burning. Okay, there's going to be a couple days of, yeah, this sucks. And it's similar to being like punched in the arm, like when people do the game of slug bug. It's going to be bruised for a couple days. That's a normal healing timeline. What's not a normal healing timeline is when you have this for weeks and weeks and months and months and months. It should be reducing on its own. If it's not, you need one-on-one professional attention. Now, slight variations to this is going to be, as I said, moving the hips underneath the chair. Because I can't do that, instead of moving my hips between my shins, I'm going to move my shins between my hips, which for me is a little uncomfortable because I'm having to fight to be in it. That's why being in like underneath the chair is better. Or if I wanted to, I can actually put my hips against the wall and put my feet on the wall. That way they're a little bit more rested. Okay. But if I were to choose my version at home for me, it's going to be here completely relaxed. All right. In some of the other videos we've done, we talked about breathing. Breathing into the floor, right down into here, is helpful just to settle everything down too. If you wonder about how breathing is a relationship on this, we cover that in the webinar. But in simple terms, the core is the master of the pelvis. The pelvis is the master of the hip. The piriformis goes from the hip to the pelvis, or the sacrum, if you will. So being in this position and trying to manipulate the position of your pelvis with pressure or core function is actually kind of important. It's an advanced technique. So that is one of our basic offloader positions, the rescue position for things like piriformis tension. Now, to get back into full activity, most people need to do something like a series of stretches or exercises or habit changes that need to happen throughout the day for a little bit of time to make it so your body recovers better. Most of the time these things return. Some of you who've been watching the video, you notice that I've had this thing like 10 times throughout my lifetime. Well, yeah, it's very common for things to return, and that's not to say that you're broken or that it won't ever really go away for long periods of time, but I usually tell people that, you know, if you didn't have this again for 10 years, that would be considered a really good success. And usually management of the condition and setting you up for success is much more than just pain management, although it is a small part of it. So if you guys are looking for help, reach out to us via the link description below. Subscribe to the channel. We'll see you next time.